Hello, I'm Dr. Ward Dean, Medical Director for Vitamin Research Products. The first International Anti-Aging Conference, which was sponsored jointly by Vitamin Research and International Anti-Aging Systems, was held on June 17th and 18th, 2000 in Monte Carlo, Monaco. The conference attracted scientists, clinicians, and anti-aging enthusiasts from around the world. These tapes offer an opportunity to listen to the wealth of information that was presented. For those who were unable to attend the conference, it offers a hint of the experience that they missed. Please join me as I listen to one of the speakers at this breakthrough conference. I cordially invite you to join us at the next conference in Monaco next year, which promises to offer a similar roster of international specialists in anti-aging medicine.
I'd like to go straight into our next speaker. He is one of the most ardent and active supporters of anti-aging medicine. His military experience and decorations are extensive, and they culminated in the position of commander and surgeon for the elite Delta Force. Since his entry into gerontology, he has contributed a number of major milestones, including the magnum opus, The Biological Aging Measurements, and the Smart Drug series of books that introduced the concept of nootropic drugs and nutrients for age-related mental decline. Without further ado, please, Dr. Ward Dean.
Thanks, Phil. Now, as I talked about during my first talk, the orthodox medical community believes that aging is not a disease. And I think this was exemplified most profoundly when I was at the International Congress of Gerontology and Geriatrics in Acapulco in 1989, when the Mexican government was really putting on a big show. They had one of the leading singers in the country came out and sang a song specifically written and composed for the conference. And this was a song that was extolling the virtues of growing old. And I thought to myself before I walked out, this is absolutely incredible. Can you imagine going to a meeting of cardiologists, having someone standing up there singing how wonderful it is to have a heart attack, or going to a Cancer Society meeting talking about how wonderful tumors are for you? So clearly, again, my philosophy is that aging is a disease, and that's the way I looked at it when I first opened my practice in anti-aging medicine back in 1985. And at that time, I knew from working in the hospitals that we always drew flow charts monitoring how our patients were doing. And I realized that if aging is a disease, we really need to have some way to measure it. And that was why I began investigating the concept of biological age. Now, biological age in the literature was exemplified by a number of studies from research institutes around the world where they would perform a battery of tests, evaluate the changes across the age range, and determine which tests in particular were most closely correlated with healthy chronological age. And they would then run these through a statistical program, usually using factor analysis or multiple regression equations, and come up with an equation where you would plug in the values and come up with a composite biological age. And this has been the goal of gerontologists for many years. And I'm sorry to say that we're still looking, although the studies that I'm going to talk about briefly today were all done virtually with pencil and paper, and at best with calculators, very few with computers. So there's been a gap because the biomarkers, for the most part, that I'm going to talk about are up through about 1985. And there's been a virtual dearth of publication on biological age and aging measurement since that time. Virtually everything goes down with aging. The one thing that doesn't go down, the one thing that does go up is mortality from virtually every disease. We've all been trained, double-blind controlled studies. You wait till all the results are in before you determine that. Well, as far as I'm concerned, that's called the last man standing test of an anti-aging substance. It may very well bring about immortality, but it will take forever to test it. And that's why we are searching for biomarkers, for ways of measuring biological age so that we can measure over the short term, because we don't have forever. We don't want to be the last man standing to determine if that particular life extension anti-aging regimen worked. We want to determine things over the short term, say 6 months to 2 years, whether a particular regimen, an intervention technique is actually doing anything to delay the aging process or reverse biological age. In 1982, I started collecting this series of aging measurement test batteries that had been conducted by research teams around the world. One of the teams was Professor Dumitriu's team in Romania. There were a number of teams in Japan, the United States, and a number from the Soviet Union. There was probably 30 different test batteries using variations of different clinical, physiological, and biochemical tests. Now, every test battery was flawed in a major way because they would either use a particular test that was unique to that institute using a piece of expensive equipment that few physicians would be likely to have in their office, or a test that was very expensive. For some reason, every test had a built-in fatal flaw that prevented it from being used clinically. So I took all the tests, the number of times they were used in the various test batteries, put them on a spreadsheet, and you'll find that most of these tests are the tests that we use normally whenever we do a physical examination with equipment that's really not very expensive. Now, the difference is that, as we've talked about before, we've got the bell-shaped curve of the average or the normal population. Well, we don't really want to be normal. We want to be optimal. And so within that normal bell-shaped curve, there is a wide range. I think the range of IQ from 80 to 120. And do we want to be within that bell-shaped curve? Well, obviously, we want to be skewed out on the high end if we can. And the same way with each one of these particular tests. This is features that we want to have in an ideal biological aging measurement parameter. Standardized, non-invasive, correlates with chronological age changes over time, should be something that changes. Inexpensive, convenient, obviously for the patient's benefit. Should evaluate aging at several levels, whether it's at the macromolecular level, at the cellular level, or at the whole body level, and that it evaluates aging based on the theories of aging. For example, various measures of oxidative stress can be used intervening in the free radical theory, hormonal tests, and some functional tests that evaluate the neuroendocrine levels. So ideally, you would want, if you have a theory of aging and you have a way of intervening in that particular cause of aging, your biomarker panel also ought to evaluate what is going on in that particular organ or organ system. Now, these are some of the most commonly used biomarkers, and what's significant down here is baldness and grayness was used quite frequently. And of course, this is really one of the first things you look at. Look at skin and hair, the color, and the amount of it. And certainly, as one scientist told me a long time ago, no one dies of old skin, but the skin, of course, is the largest organ in the body, and it does perform a number of useful functions: protection, maintains hydration, maintains body temperature. Now, some other tests that were not used specifically in any of these aging measurement test batteries that were used prior to 1985, there were virtually no tests of hormones. Part of that, I think, was due to the difficulty in testing for the hormones at that time. Some other tests that are not in the hormonal area, specifically glycohemoglobin, which, of course, I beat up on insulin quite a bit, and I think this is probably one of the best ways of monitoring glucose tolerance over time, and also as an indirect indicator of our insulin levels. Ferritin, carbonic anhydrase is one that's not very familiar to many people, but it has been proposed as a biomarker. PSAs, I've been doing PSAs since 1985, and also C-reactive protein. A couple of tests that, again, are considering but haven't been widely used are measuring thymic factors as an indicator of immunity, and also hypothalamic releasing factors, which I think as the tests become more readily available will also become more widely used. Finally, bone mineral density, equipment to accurately analyze bone mineral density, which is clearly a biomarker and also a risk factor for osteoporosis and fractures, BMI, body mass index, and basal metabolic rate. I'm going to talk specifically about basal metabolic rate and a way of cheaply and easily testing for basal metabolic rate. This is really what we're looking for. Ideally, we'd like to have one instrument that does it all. Right now, this is probably the best integrated instrument that measures biological age. This is designed by Richard Hochschild. Dr. Hochschild, he is a guy who has really paid his dues. He has done lifespan studies with experimental animals using central phenoxine, and he has been developing the H-scan for over 30 years. He's not a Johnny-come-lately to the gerontological field, and over the years I've watched the H-scan change from a suitcase-size box that literally took up an entire desk down to a unit that is about the size of a laptop computer today. And what this test does is that it combines 12 separate biomarkers into a composite biological age. Now, these are some of the advantages of an instrument such as this, because it does not require an operator. You plop the person down in front of the computer, and today it's even more familiar than when he originally started out, because when he started out, computers were pretty rare. Well, now everybody knows how to sit down in front of a computer and follow the directions, and that's really what it does. It takes about 45 minutes to operate this. One problem that I had when I was doing biomarkers the old-fashioned way was that every time I'd train a new tech, there are some techs that do things very precisely, and there are some that do them very sloppily, and so you get quite a wide variance. Well, this eliminates operator error. Every test is highly repeatable. The equipment is the same. Doesn't matter what physician is using it, the equipment is all the same. All the results can be combined in a central location, which increases the database vastly. You can test large groups. In fact, that was one of the reasons this was originally designed, was for insurance companies. No staff costs. Unfortunately, I think the price is in the $25,000, $30,000 range now. Don't need to train operators, and the people that conduct the test on themselves, they really like it. It's like playing a video game, and they get a score, and then they want to come back 3 to 6 months later and see if they can do better. Now, the problem with this instrument, and I've told Dr. Hochschild about this, is that what he does, he just keeps on making the hardware better and more advanced, but he's never added one test since he began, even though it was based on a test that was originally done in Holland. And what he really needs to do, I think, is add tests of blood pressure, hand grip strength, and also put some clinical chemistry values in there, which he doesn't have. He wants to keep it non-invasive, but I said everybody's got a blood test. They could bring that in, conduct the test, and go through it. These are the 12 parameters that are measured. A couple of things that are unique about these. One is that he's automated the test of near visual accommodation, near vision. This is probably one of the best and most accurate tests of biological age. Now, you don't need to spend $30,000 to get an H-scan to do this. Really, all you need is a business card or a playing card and a yardstick. And you hold the yardstick out, and then you slide this just up as close as you can until the card begins to blur, and that is the near point of vision. These results are based on a study that was done back in 1922, and it hasn't been improved upon since. When I had my office out there in Beverly Hills, an Australian TV group came over, and I think it's Beyond Tomorrow or Beyond 2000. So as I was demonstrating this particular test to the producer, because he really wanted to see how these biomarkers worked, and I said, well, I guess you're about 52. And he about fell off the stool, because I nailed it just exactly right. And the cameraman said, okay, now let's do it again, and we were going to get it on film this time, and I want you to look just as surprised as when we did it the first time. this test of near visual accommodation, Hochschild has automated this, which is quite an engineering accomplishment. It also does pulmonary functions. It tests the vibrometry. This is your tactile sensation. This is known to decrease with aging as well as with some diseases like multiple sclerosis and diabetes. And it comes out with a nice full color printout that the patient can take home, and he can see what his biological age is, how he stacks up with other people of his similar age. So when money is no object and you want the top of the line aging measurement instrument, this is definitely the instrument to buy. Now, when our Smart Drug books came out, my co-author John Morgenthaler, now with Smart Publications, we realized that one of the biggest failures of taking cognitive enhancing substances was there really was no good way to evaluate whether they were doing anybody any good. And after the books came out, we were approached by these folks that made Think Fast. And these folks have now gone beyond Think Fast, and I encourage you to go to their website, very easy to remember, brain.com. And at brain.com, they used to sell computer disks that had the program on it. Now, you and your patients can directly log on to their website. They have a free test that measures short-term memory, button tapping, reaction time. I think there's 4 or 5 free tests that are on their website. And if you enroll as a physician, and then you can direct your patients directly to the website, and the fee is really nominal. What they are doing is they are collecting a database from everybody that logs on. So this is a very interesting program, and they will actually compare your performance from test to test over time, so you'll be able to evaluate whether or not a particular smart drug regimen is actually having the desired effect. They've got a tremendous staff, board of directors. In fact, one of the members of their board of directors is a Dr. Maga, who was probably one of our biggest antagonists when the smart drug books were newsworthy. The news media would always try to do a balanced reporting, and they would bring out Dr. Maga, and as we refer to him in Smart Drugs too, we call him crusty but lovable Dr. Maga, and he is actually on their board of directors. So I think he may have made the switch now, so I highly recommend that you check out brain.com. Now, Dr. Daniel Hershey, I've known him for years as a fellow member of the American Aging Association. He is not a physician. He is a chemist, a PhD. He's in the Department of Nuclear Engineering at University of Cincinnati. And he has developed originally an in-office calorimeter to measure basal metabolic rates. He's got software that goes along with this device, which would actually predict a person's life expectancy based on the calculated basal metabolic rate, as well as using data that was taken from the Baltimore longitudinal study. So this is a really well-researched instrument. Again, unfortunately, this thing cost $10,000. Now, that's the bad news. The good news is that Dr. Hershey has gone further than this. He no longer sells this instrument. He now has a baseball cap that costs about $500 that a person puts on, and it has all the sensors in it, and this baseball cap will go ahead and determine the basal metabolic rate. The software goes along with it, and that is the Basal Tech whole body calorimeter, but it's not the in-office device anymore. It's now a baseball cap. Now, it was kind of interesting back in about 1988 when my book first came out. I was at a meeting of the American Aging Association, and the president at that time was Dr. Arthur Balin. And Dr. Balin was bemoaning the fact that there was no way to measure biological age, and we really needed to get a book out there that would do that. And Dr. Lipman, who's sitting in the back of the room there, said, well, Arthur, Dr. Dean just wrote this book. He's already done it. So I talked to Arthur, and we got together and collaborated. I gave him my mailing list of all the scientists who had conducted the studies that I reported on in my book, and he contacted them and had each of them write a monograph on their particular approach to aging measurement. So while my book is a more practical, hands-on, how to do it book that's got all the biomarkers and shows what goes up and what goes down, This is an outstanding companion volume because this is actually written by the people who conducted the test themselves, and there's a lot more theoretical background in that book. And finally, this book I highly recommend to everyone. This is Physical Dimensions of Aging, and this is a virtual encyclopedia of what goes up and what goes down with aging. Had I seen this book, or had it been out at the time I wrote my book on aging measurement, I probably wouldn't have done it. Because this book, as I said, it's an absolute gold mine, wealth of information. I can't recommend it highly enough. Now, that concludes the talk on biomarkers. How many people in here have heard of GHB or know what GHB is? And how many who know what it is have tried it? Okay, how many people have heard about the date rape drug? Okay, I see more hands. Okay, those who never heard of GHB but who have heard about the date rape drug, or who know that GHB is the date rape drug, have been victims of the big lie. This is the old story. You tell a big enough lie often enough, and pretty soon people start to believe it. We know from watching television and reading the newspapers and magazines that GHB is a highly toxic, dangerous, designer drug that is responsible for the rapes of thousands of women and also for the deaths of numerous people, including River Phoenix. Well, everything that I just said about it was a lie. GHB is actually the safest, most non-toxic, non-habit-forming, sleep-inducing substance known. It's a naturally occurring substance. Everyone in this room is currently in possession of it. It has recently been scheduled by Congress in the United States as a Schedule I substance, putting it in the same category as crack cocaine. So now this virtually makes everyone in the country an unindicted felon, because possession of any amount of a controlled substance is a criminal act. Now, what's the real truth about GHB? It is, as I said, it's the safest, most non-toxic, non-habit-forming sleep-inducing substance known. Unlike other pharmaceutical sleep-inducing substances, however, GHB induces normal sleep. In fact, it enhances normal sleep. It makes it more restful, and while people are sleeping, it enhances stage 3 and stage 4 sleep. This is the period of sleep when growth hormone is released, and in fact, GHB does induce release of growth hormone while we're asleep. This is virtually the one substance that we can really take at bedtime and lose body fat, build lean body mass, increase bone density while we're sleeping. It reduces the oxygen requirements of the heart and the brain. It lowers cholesterol. It is the treatment of choice for narcolepsy, cataplexy, and other sleeping disorders. And this, in fact, is what it is being studied right now under FDA-sanctioned INDs. It's also been used in schizophrenia, Parkinson's disease, fibromyalgia, chronic fatigue, nocturnal leg cramps. It's a muscle relaxant, back pain, alleviates migraine headaches. This is truly a miracle molecule. Roy Walford, when he wrote his book, Maximum Lifespan, devoted a chapter to his search for a substance that would safely and effectively lower body temperature, because he believed that if we could drop our body temperature by about 2 degrees, we could extend our lifespan by about 10%, because he was trying to find a substance that would induce hibernation, literally. And GHB does that. While we're asleep, body temperature drops about 2 degrees. So based on its ability to cause the release of growth hormone, and based on its ability to lower body temperature, as well as to induce sound, restful sleep, I believe that GHB is one of the most profound and potentially effective anti-aging substances there is. And I think that that's probably the reason, because it is so effective for so many things and should be or could be fairly inexpensive, is the reason that it had to be demonized and had to be taken off the market. The idea and the story that we always hear that GHB is a date rape drug because it induces coma. Well, of course, if we look up in our medical books, the definition of coma is unarousable sleep. But along with every definition and every type of coma, there is always some kind of toxic adverse effect going on. And this does not happen with GHB. GHB is processed and metabolized rapidly by the body. It's metabolized into carbon dioxide and water. There are no toxic circulating metabolites. There's nothing left after it is out of the body. There's been one excellent study on the use of substances to facilitate rape. This was a study that was published last year. They examined the urine of 1,200 women who had been allegedly raped and analyzed them for any possible mind-altering substances that could have been used to facilitate the rape. Well, in the majority of cases, the only element used was physical force. In about 42%, the offending agent was alcohol. And it went down from there. It was alcohol, marijuana, crack cocaine, benzodiazepines, including Rohypnol, which is the real date rape drug, benzodiazepines, amphetamines, and finally, in about 4% of the cases, GHB was used. And in most of those cases, unlike the stories that you read about in the newspapers, the GHB was not slipped surreptitiously into the girls' drinks. They took it voluntarily, willfully, and they knew what they were taking. Now, we recently had a case. I was called by one of my patients who lives in Alabama, who works for the district attorney's office there, who also has narcolepsy, and he said, "Do you know about the bill that they're going to introduce in Alabama?" It was the first I'd heard about it, and they were going to make possession of 56 grams, or about 2 ounces, of GHB punishable by life in prison without parole. I laughed. I couldn't believe it, but that was what they did. We called for open hearings, so we went up, he and I and a 72-year-old fitness instructing grandmother from Oregon went in and testified before the committee. And of course the Attorney General was there telling about the 24 date rapes using GHB that they'd had at Auburn University, and the narcotics guys got up and told about how it's being used at all these rapes, and they had the state medical examiner talk about the 4 GHB-induced deaths that they've had. Now, I've looked at a lot of the autopsies of folks who had allegedly died from GHB, and I have yet to find anyone who has died from any toxicity of GHB. There have always been extenuating circumstances, combinations with other drugs, or in fact, in many cases, GHB wasn't involved at all. So after the testimony of the Attorney General and the state medical examiner, I got up and I said, "Mr. Attorney General, I believe that rape is a crime in Alabama, and I believe that using a mind-altering substance to facilitate rape calls for enhanced penalties. How many prosecutions for GHB-facilitated rape have you done in Alabama?" Well, the answer was a big fat 0. There were absolutely no rape determinations, no toxicology studies, and no prosecutions. This was a figment of somebody's imagination. And then I asked the state medical examiner to provide me with autopsies of the alleged deaths. And about this time, I also pointed out that everybody in the room would be an unindicted felon, and that anybody that went out and bought a Big Mac would actually be consuming enough GHB-tainted beef to earn 2 life sentences without parole under that law. And at that point, the senator who was executive director of the medical board said, "Well, I thought I knew a lot about controlled substances, but I find out from this I don't," and they tabled it. And we came back 2 weeks later. Getting those autopsies was like pulling teeth because they just didn't want to give them up. But the Attorney General, in fact, is the one who told the medical examiner, "They're public documents, you've got to cough them up." Well, one of the deaths was a guy involved in a traffic accident. Another death was a guy who had sleep apnea, for which GHB is of potential benefit, but he took his GHB after consuming 8 beers. The third person had GHB along with ketamine, which is a very powerful anesthetic. Its street name is Special K. We used to use it in Special Forces to paralyze goats when we were in the goat lab. And the fourth person, who was unequivocally a GHB-related death, that was the real tough autopsy to get, and in fact, they still haven't coughed that one up. They finally revealed that there was no GHB involved at all. And this is absolutely typical of the cases involving GHB. Probably the most publicized GHB-related death was the one where the three young men, I think they each got 25 years, Samantha Reed. In fact, it was the Samantha Reed Hillary Farias Date Rape Drug Prevention Act of 1999, which was the law that caused GHB to be scheduled. It was originally called the Hillary Farias Date Rape Drug Prevention Act of 1999. When we wrote our book on GHB, we questioned whether she died of GHB because she only had 27 milligrams per liter of GHB in her blood. And I said, well, if you calculate total body dose, that's not even enough to give her a good buzz, let alone kill her. Subsequent to that time, there have been 2 studies that came out that showed that GHB is produced endogenously in the body post-mortem in unpreserved blood. And Hillary's blood wasn't examined until 6 weeks later. There was another study by the California Toxicology Institute. This is the preeminent forensic lab for analyzing GHB in the United States. And they did a study of about 20 people, and they found levels up to 165 milligrams per liter in post-mortem blood. And another study was done by the Los Angeles County Coroner's Office, where in 100 people they found GHB in virtually everybody. In fact, they said anything under 50 milligrams per liter has got to be counted as an endogenous production of GHB. So most of the alleged GHB-related deaths did not occur. Most of the alleged GHB-related rapes did not occur. But when you've got a substance that is a better antidepressant than Prozac, Paxil, and Zoloft, a better anti-anxiety agent than Xanax, Halcion, and Valium, that's a better euphoriant, a safer euphoriant than alcohol, which doesn't wipe out brain cells, doesn't pickle the liver, you're stepping on some very big financial toes. And it's very clear that this coordinated effort that GHB had to be removed from the market for that purpose. So they sent out their hitmen from the FDA, from the DEA. The controlled media, of course, kept beating the drum, and we kept wondering why we couldn't get the truth out about GHB. And this latest case in Alabama, where I found out that the bill originated with the DEA, was fed to the Attorney General and was monitored every step of the way by the DEA. This is clearly controlled from someplace on high. So the bad news is now GHB is a Schedule I substance in the United States. There's also 2 precursors out there of GHB. One is a substance called GBL, gamma-butyrolactone, and the other is 1,4-butanediol. Now, the GHB detractors, I used to go into court, and Sharon Kern, who worked for the Justice Department, she was sort of the queen bee of Justice Department prosecutors, and I would be telling people how safe it is and how it's probably one of the safest substances known. The toxicity threshold is about 40 to 60 times higher than the sleep-inducing dose. I mean, it's just overwhelming. It's safer than table salt based on comparative LD50s. And Sharon Kern would say, well, Dr. Dean, isn't it true that you make GHB with sodium hydroxide? And isn't that lye? And GBL, isn't that an engine degreaser and a paint stripper? And I'd say, yes. And she'd, well, and you're saying that's safe? Well, of course, when you combine these 2 substances, they turn into GHB. Now, GBL itself is an extremely safe, non-toxic substance. When it is consumed, it is converted by an enzyme that naturally occurs in the body called lactinase, and it converts the GBL into GHB. Toxicity studies were conducted by OSHA because it is an industrial solvent. It is a paint stripper and an engine degreaser and a flavoring agent in pineapple ice cream and a clarifying agent in wine and beer. Gavage-fed experimental animals doses that were 10 to 20 times higher than sleep-inducing doses in humans. They did this 5 days a week for 2 years. Literally rammed this stuff down their throats. I don't know how these animals stayed awake long enough to eat. At the end of that 2 years, they found absolutely no organ toxicity whatsoever, reduction in breast tumors and liver tumors, and there was an extension of lifespan of the female mice. There were male mice involved in the studies, and There was a slight increase in deaths because they died fighting. I don't know whether they were fighting over the females or whether they were just staying young and vigorous and aggressive. But clearly, this is one of the safest substances known. Another substance, butanediol, is an intermediate in the manufacture of plastics. They manufacture 400 million pounds of GBL a year, and they manufacture 800 million pounds of butanediol a year. Butanediol had the same safety level as GBL. They did the same toxicity studies. There were no teratogenic effects whatsoever, even when they gave these same high doses to pregnant animals. In fact, obstetricians in Europe used GHB to facilitate birth. It enhanced dilation of the cervix and prevented neonatal hypoxia. I've had patients who have taken these substances throughout their pregnancy and delivered healthy children. And as I said, the studies on animals revealed absolutely no teratogenic effects. So getting rid of GBL and BD is not quite as easy as going down to Colombia and ripping out the poppy fields, or going down to Mexico and spraying the marijuana plants with paraquat. These are valuable, essential industrial chemicals that they can't get rid of. Now, they published the law against GHB on the 13th of March. On the 23rd of April, they published a regulation on GBL, gamma-butyrolactone, the one agent that converts to GHB. Now, they made GBL, they couldn't take it off the market, but what they did do is they made it what's called a List 1 chemical. Now, this is a chemical that can be converted into a controlled substance like crack cocaine or amphetamine precursors. So it's still out there. I know many people, after that law passed, they dumped their supplies out. There is no law against owning a List 1 chemical. The problem is with the seller. Producers and the sellers can't sell it to people who don't have permission from the DEA to own it. But you don't need permission from the DEA to own the substance, because there's lots of legitimate uses out there. So I think this is a problem for them. With butanediol, there is absolutely no regulation on butanediol whatsoever. But this doesn't stop them. Dr. Wright talked about the rats, and I think he's being kind, because these people are worse than that. I talked to a distributor for a product called Soma Solution last week, and I was surprised to find that he was still in business. So he had his post office box on the bottle. I wrote him a letter, and I said, well, give me a call. I'd like to find out what's going on. So he called me up, told me that he's kind of lying low, and he's only selling to his old customers. He's not going to go out and advertise it and promote it and put it in his health food store window anymore, but he's going to continue to supply his former customers. And I said, well, that's really fine. I lauded his efforts and talked about some legal issues, and I wished him well. Got a phone call from my wife about a day after I arrived here. She just received a phone call from this fella in Kentucky that he was concerned that my telephone line was tapped, and of course I laughed and I said, well, what else is new? And the day after he and I spoke, he got his doors blown in by a bunch of armed federal agents. He wanted to see the search warrant. They said they don't have to show him one. Proceeded to rip up his store, rip up his computers, and of course he was left wondering what to do. There are some things that he can do, and I'm going to have to get back with him when I get back. But the fact that BD is not against the law does not seem to stop the people that want to keep control of GHB. Well, that's all the bad news now. What do we do to obtain this unobtainable product? As I mentioned earlier, there is a pharmaceutical company that is continuing to conduct the studies to get GHB approved as a pharmaceutical agent. It'll be a Schedule III, but at least we'll be able to have access to it and get our patients back using it, the people who need it. Sleep deprivation is one of the most common causes of fatigue. It's one of the most frequently related occurrences with aging, and here we have this substance that will normalize and actually enhance normal sleep. I would encourage you all to contact the pharmaceutical company. The pharmaceutical company is Orphan Medical, and their website is orphan.com. And for physicians, I would encourage them to contact the pharmaceutical company, let them know you're a physician and that you would like to know how to get involved in the clinical studies that they are conducting, because as supplies are drying up and there are people in a real need out there that benefit by this stuff tremendously, it really normalizes and allows them to have their life back. And I've talked to a lot of people who used to be in the clinical studies. These are patients, and even though they are no longer participating in the studies, they are still being provided access to GHB from the pharmaceutical company, and I think that's a way of keeping them quiet, because they don't want them going out, you know, when the articles come out about the date rape aspects, going and saying, hey, I'm getting this stuff from the pharmaceutical company. So I have a hunch that's what's happening. Hopefully, and I hate to encourage the pharmaceutical companies, but it looks like right now that's going to be our only route until some gutsy guy challenges the law. He's going to probably have to have a lot of money and a large set of gonads to do that, because these are bad guys that are going around kicking in the doors. So that concludes both the biomarker and the talk on this, what I think may be one of the most beneficial anti-aging substances known. Hopefully we will soon have access to that. So thank you all for coming.